Welcome to another exciting episode of In-Depth Eye Health Podcast Series, brought to you by iFocus and iHub Nigeria Initiative. The series provide incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen. Hi everyone, I'm Dr. Ifimonye. Today we will be discussing computer vision syndrome, its significance and ways to effectively manage it.
Hi everyone, I'm Dr. Mustafa Bature. Our guest for today is Professor Feyi Adepoju, consultant ophthalmologist at the University of Ilorin Teaching Hospital, and a public health expert in ophthalmology. In addition, she is the current advocacy director and secretary of the African Ophthalmology Council. Thank you for joining us, Ma.
Thank you very much for having me.
Welcome, ma'am. May is considered Healthy Vision Month and widely celebrated by the National Eye Institute and health workers. What is computer vision syndrome?
Thank you. Computer vision syndrome is a condition that results from the eye focusing on a computer or other visual display terminal devices, such as tablets or cell phones, iPad or e-readers, for a protracted and interrupted period of time, resulting in eye muscle strains because the eye is not able to maintain focus on a closed object without stress. So usually this condition also have an association to the muscle strain, some form of dry eye resulting from frequency of blinking. And of recent, we have also seen that particularly in children, there can be development or worsening of short-sightedness or myopia. So it's a condition that results from these three major reasons. But baseline is that the eye is focused on a near object, particularly a computer visual display terminals, uninterruptedly for a long period of time.
Considering the clinical features at presentation, how much of a difference is it from refractive errors?
Yeah, typically computer vision syndrome patients present with headaches, blood vision, eye strain or fatigue, symptoms of dry eye with gritty sensation or foreign body sensations. Some may have redness, double vision, and then complain of difficulty refocusing the eye. Why myopia or short-sightedness have to do with a refractive error of the eye in which the eye is not able to focus properly objects that are near to the individual. So there are structural changes in the eye in short-sightedness. Typically, we say the eyeball is probably too long, and that is why they have short-sightedness, because images are not formed on the retina. But as I said, in children, we're also seeing increasing prevalence of short-sightedness, particularly more in children who are involved with close work for a prolonged period of time. So they are different, but then there's a little meeting point, as you could see.
Thank you very much for that clarification, ma'am. So with the advent of distance learning as the new normal in the wake of the COVID-19 pandemic, what would you advise people to do in order to prevent and or manage computer vision syndrome?
Okay, so maybe what I first like to talk about is some of the risk factors that make computer vision syndrome more problematic or more prevalent. We've talked about uninterrupted, prolonged exposure to visual terminals, but this is also heightened when there are underlying uncorrected vision problems or when wrong prescriptions are worn for an existing refractive error. It's also made worse if there's poor lighting or poor or improper posture or improper viewing distances through these display terminals, or it could be a combination of all of these factors. So now understanding how this condition arises it then becomes easy for us to follow and understand some of our advice or what we expect the people to do to be able to overcome this challenge. So the first thing is we need to observe breaks within the period of time that we are working on visual display terminals or computers. Popularly now, we talk about the 2020 rule. We expect people to take a 20-second break to view something, an object that is at least 20 feet away after every 20 minutes of working on the visual display terminal. Very simple rule. So you have worked on your computer for 20 minutes. We expect that you take a 20-second break to focus on objects that are 20 feet away. Of course, if also anyone has worked on computer for 2 hours continuously, we expect that they at least take a 15-minute break. At such break, we expect that they can move around, take a cup of water, view distant objects, relax, or sometimes just close their eye briefly, and then they can return back to work. So that's one main way of us trying to address or correct this problem. The other thing we try to do is to encourage individuals to regulate the brightness of their computer screen, reduce the amount of glare that they are exposed to on their computer. We expect people to be able to adjust their working distance to their computer and ensure that the screen they are looking at typically is placed about 20 to 28 inches from the eyes, and that their computer screen should be slightly below the eye level. All these adjustments are usually termed ergonomics of working with the computer, so that the risk of neck pain and all the other eye strains can be reduced. We also expect that sometimes we use a screen over the monitor, so that the amount of brightness and glare coming into the eye is reduced. Several other things we can do to prevent eye strain or to treat eye strain. And so we expect, and we also advise that if there are dry eyes, or to prevent dry eyes, you should blink regularly in the course of working on the computer, because it's known that when we are working on closed monitors, people tend to blink fewer times than normal. Our use of computers or visual display terminals a bit more comfortable to the users. So if you have such devices, we can make use of them. Of recent, people have actually promoted the use of blue filter kind of lenses, because we have realized that the blue end of the spectrum tend to give more visual symptoms in terms of computer visual syndromes. And so there are lenses now that just have the ability to reduce the amount of blue light that is coming into the eye at the time of working on the computer. So if you meet or visit the ophthalmologist or eye care provider, they're able to look at you and find out why you're having this asthenopia or vision-related issues, and then be able to profile or offer specific recommendations or treatments to address the need.
Oh, thank you so much for those ergonomics. Those are useful tips, and we appreciate you for this session. It has been a wonderful time.
Thank you.
Trying to know the concept of computer vision syndrome and how we can tackle it. Okay, Feyi.
Thank you very much, Ma, for joining us.
All right, thank you.